City of London has a population of about 400,000 people, and as a municipality we deliver over 100 services to Londoners every day. And it's partnerships with groups like Infrastructure Ontario that allow us to really deliver value to Londoners, to provide the services that mean so much to them on a daily basis, and allow us to do so in a very efficient way. The Normal School was constructed in 1898 in Old South, and ever since has been a very important and iconic building within both the neighbourhood and the city as a whole. Infrastructure Ontario worked with us to come up with an alternative procurement process, and that helped us to find a use that would be sustainable within the Normal School and allow it to be economically viable for the long-term future. That use was in fact the YMCA. It's been tremendous in terms of what the Y has been able to provide to the community. One component of the YMCA's use of the building is an administrative office, but there's also a series of community-oriented services, including youth services, child care center, newcomer welcoming services, not to mention a tremendous village green and a gathering space for the entire community. As a city planner, I think a lot about city building, and for us to deliver the kind of infrastructure that creates great cities, healthy neighborhoods, the type of community that people want to live in, we need to work with partners, and Infrastructure Ontario is one of those partners that help us to establish the kind of infrastructure we need for a great city now and in the future.
This beautiful building comes out of 17 years of restructuring of mental health programs in the southwest region of Ontario and in London Middlesex in particular. So this restructuring has brought us to the culmination of mental health care located in the two building spaces, but the buildings themselves interact with the communities that surround them. We really want to use our building as a hub to demonstrate destigmatization of mental illness by integrating the mental health care space into the community in which we are residing. The Infrastructure Ontario program has allowed us to bring the world of private and public participation together to create this magical space in which we can care for people who have mental health concerns in the best possible way. So you will see in our space a library, a chapel, a multi-faith space to cater to patients who have diverse spiritual care needs. You see a gymnasium in which we really try and attempt to integrate meaningful activities for the people that we are serving, such as basketball games, hockey games, things like that. And we try and bring community into this space as well. You will also see our multi-purpose auditorium space. And in this auditorium, we hold things like staff engagement sessions, staff education programs, patient education programs. And in the future, we want to start a public education series where we would bring members of the public into this space and expose them to various topics that relate to mental health and mental illness.
I'm a patient council member of Parkwood Institute. I'm also a registered volunteer of St. Joe's Healthcare. I try to give back as much as I can, lending a helping hand and being there for them.
I'd like to welcome you to Earl Nichols Arena. We have 3 sheets of ice here, a community center, a meeting room. Infrastructure Ontario loan program has helped us out here by replacing the low efficiency lighting with high efficiency energy saving lighting. This has helped to serve our community by reducing our energy costs now and in the future.
Infrastructure is extremely important to the City of London. From the roads that we drive on, the transit that we use, the water and the wastewater systems and services that we provide, Infrastructure Ontario's loans program has enabled us to provide for the infrastructure needs relevant to this community's needs. That has in turn provided us with the opportunity to keep our costs for transit, road users, and other infrastructure needs at a minimum.